meeting to order. Amy, if you would start with the roll.
Dr. Jones?
Here.
Kathy Manuel? David Lees?
Here.
Dr. Vera Weiss?
Here.
Dr. Goodwin?
Here.
Dr. Hick? Here. Dr. Reichstadt? And Dr. Peters?
Thank you so much, Amy, and thank you for everything you do for us. You do an absolutely amazing job, and I greatly appreciate it. So thank you. Approval of the agenda. Do I have a motion to approve the agenda?
Move to approve the agenda.
Okay.
Second.
Moved and seconded to approve the agenda. Any discussion? Hearing none, all those in favor? Anyone opposed? Abstentions? Public participation on our agenda items. Seeing no public, we'll move forward. Any correspondence or communication? Thank you. Our next agenda item is approval of the agreement between the Champaign-Urbana Public Health District and the County of Champaign and Champaign County Health Department for the provision of public health services by the Champaign-Urbana Public Health District to the Champaign County Health Department. It came to our attention just before Christmas that the current contract was going to expire at the end of December. We were under the impression, to give you some historical perspective, that this was a 10-year contract, which was what had initially been voted on by this body, but when it went to the county, it had been changed to a 5-year, and there was, some communication lag back. And so we were contacted that it was going to expire, and so we are okay, just so you know, if we have like a 30-day window grace period, we were okay with, thus we needed to have the special meeting prior to the end of January to pass this new contract so that both the Champaign-Urbana Public Health Board and our board can pass and they can move forward with the agreement so that all of expenditures, including pay for employees, can be taken care of adequately and seamlessly. So we just want to make sure that was taken care of. So my apologies for not bringing this up in our previous session, was not aware, and also my apologies for again having to bring you forward for this session. Yes.
Is there a copy of the contract?
Yes. Here. Yes.
And just to let you know what has changed, basically, Matt Bannock from the county sent it out to back and forth with us many times. Really, the only thing that has changed is some language specific to environmental health that changed because the law changed, so now we're using a different food code, using the FDA food code. So that changed, and then the appendix at the end changed because we always change that. It's just what services we're doing each year. So,
Okay.
so that's all that changed.
And again, budget items because there are different grants each.
You ready for a motion?
Yes.
I move approval of the agreement.
Do I have a second? Okay. Moved and seconded. Any discussion? Hearing, please.
Yeah, no, I'd just like to say that I'd still appreciate getting a copy of this by email. If you would send it out.
It came, so.
She sent it out, what was it, 2 weeks ago, Amy, I think?
Probably.
Yeah.
My apologies for implying that it didn't.
You said you didn't receive it. That's okay.
I can't remember. Well, we can double check, we need to be able to double check and make sure that we've got the right email and everything too, always good to do that. Any other discussion?
Cede this back to you.
Oh, thank you very much.
Yeah, for this contract, it's going to be a 5-year or a 10-year?
Five, that's what the county board, had approved the last
Docket
time.
5 years.
Yes.
Right.
Now we remember it is
Right.
5
Now,
years
now we'll
instead
know
of
it's
10.
5, and it always has been 5, but
Yeah.
last year was, or 5 years ago, it was gonna be 10, but it got changed back, so.
And I think our thoughts were, well, it doesn't change much, and we can always update the appendices as addendums and things, so our thought was, to save, time
And there's
for
always
everyone
an
to be
out, and if
expeditious.
something happens and they just wanna quit having it, there's always an out in the contract, so.
Yes, absolutely. Any other discussion? Hearing none, all those in favor? Aye. Anyone opposed? Or any abstentions? Thank you very much. That takes us to our last agenda item, which is discussion approval of a new meeting date for June. Unfortunately, I just recently learned I will be at some back-to-back conferences that I'm required to be at for some of my other positions. And I will be getting back late into Chicago the evening of the 18th, so would not be able to be here for that meeting. And so I was going to propose either someone else could run the meeting in my stead for that meeting, or we could move it and I would be, happy to, continue in that role. Just wanted to.
Discussion, Karen?
It doesn't matter to us, you just tell us what you guys want to do, and we'll figure it out.
Is June 25th okay with everybody if we move it back 1 week?
I won't be there.
I'll shoot, I'll try.
So if we can, if there's, I guess we probably need a motion to move the date to June 25th for the June meeting, and then we can post the new date for public participation. Dr. Hick makes a motion. Is there a second?
Second.
Moved and seconded. Any discussion? All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. Thank you guys very much, and my apologies for my crazy schedule. Yeah, and Amy, did you make those, or I can't remember, those the meeting dates for this year? So you have the ability to go in and like send an updated calendar invite for June
put
20,
it,
from the 18th to the 25th?
I should be able to adjust that.
Thank you. Public participation on non-agenda items. Seeing again no public, we will state that there is no one here for that participation. Our next meeting is March 19th at 5 p.m. Hearing no other business before this body, I will entertain a motion to adjourn.
So moved.
Is there a second?
Second.
Moved and seconded. Any further discussion? Hearing none. All those in favor?
Aye.
Anyone opposed? Any abstentions?
Thank you all for coming out in the
Thank you
nasty
all.
weather for this.